Hi, I'm Dr. B. Today's video is on depersonalization and derealization, or DPDR. In this video, I'll help you understand what is DPDR, what causes it, what is the treatment for depersonalization and derealization, and stay until the end to understand why DPDR is different than psychosis and being psychotic, and isn't the same as schizophrenia or one of the other psychotic disorders. If you find this video interesting and helpful, please hit subscribe. DP and DR in a big picture is a feeling of disconnection from your body in depersonalization and feeling disconnected from your surroundings in derealization. It usually has its onset by about age 16, and it's unusual after age 25, and interestingly occurs equally in men and women. Symptoms of depersonalization include feelings that you're an outside observer of your thoughts, feelings, and your body. For example, as if you're floating in the air above yourself. You might even look in a mirror and not recognize yourself. Or you may feel like a robot. You're not in control of your own speech or movements. You can have a sense that your body, your legs, your arms appear distorted, enlarged or shrunken, or that your head is fuzzy and wrapped in cotton. And even your five senses don't work right, if they work at all. You can feel emotionally and physically numb to the entire world around you. Your memories may feel all wrong, like they aren't really your memories and they belong to someone else. DR, or derealization, is subtly different, although similar. It's disconnection, but it's disconnection from your surroundings rather than your body. Derealization symptoms include your surroundings just don't feel right. For example, like you're living in a movie or a dream. You see the world tilted or blurry, and you can't bring it into focus no matter how hard you try. Or like you're watching your own life and others on a movie screen. Visually, different things in the environment can appear distorted. They might appear colorless, two-dimensional instead of three-dimensional, or look fake, unreal, and artificial. You can feel emotionally and physically disconnected from people you care about, as if you were separated from your loved ones by a glass wall, or isolated in a giant bubble with barriers that you can't get through or take down. In derealization, even time perception can be goofy. Recent events like today's breakfast may feel like the distant past, and distant events like your childhood can feel like they occurred today or just yesterday. You can experience distortions of distance and the size and shape of objects like the moon, which should be very far away and very small, actually looks very big and close. And objects that are right in front of you, like a table, can look very small. What causes DP or DR? Well, the risk factors are things like personality traits or disorders that are associated, like depression or anxiety disorders, with panic disorder especially, as well as obsessive compulsive disorders. They are also associated with specific personality disorders like borderline personality disorder and avoidant personality disorder. Other causes include severe trauma during childhood or as an adult, experiencing or witnessing a very traumatic event or an abuse, or being under severe stress that you see in major relationship, financial, or work-related stress changes. Using recreational drugs can also trigger episodes of depersonalization and derealization. Marijuana is a big one, and other illicit drugs that are hallucinogens like ketamine and ecstasy are associated. So how is depersonalization and derealization disorder treated? Well, the goal of treatment is to address the stressors that trigger the symptoms, and this often includes psychotherapy or talk therapy, and subsets of psychotherapy, including cognitive behavioral therapy, which will focus on changing thinking patterns and feelings and behaviors that aren't serving well. There is also dialectic behavior therapy, which will help you tolerate more difficult emotions, including these dissociative symptoms. Meditation and relaxation, as well as hypnotherapy, have been associated with some help with DP and DR. In terms of medicine, there is no specific medicine for depersonalization and derealization disorder. However, given the association with depression, anxiety disorders, standard antidepressants are. So why is DP and DR not the same as being psychotic, like in schizophrenia? Well, depersonalization and derealization are not a form of psychosis, because when you're experiencing depersonalization or derealization, you are actually aware that the detachment or distortion isn't reality. This is known as reality testing, and it's intact in DPDR, whereas in psychosis, like in schizophrenia, reality testing isn't intact, and you truly believe that you're flying outside your body, or you truly believe that your world is blurry, or that your arms or legs have shrunk. That's depersonalization and derealization. Thanks for watching. If you find these videos interesting, please hit subscribe and click on these additional videos where I help you understand schizophrenia and triggers in borderline personality.